Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we elaborated on the causes, diagnosis, and treatment of language disorders. In this episode, we begin our analysis of hearing disorder or HD by spelling out its nature and characteristics. Hearing disorders result from an impaired sensitivity of the auditory system. They involve difficulties in detecting, recognizing, discriminating, comprehending, and perceiving auditory information. Hence, hearing disorders damage the ability to use speech and language. Persons with a hearing disorder is said to suffer from hearing loss, deafness, or they are hard of hearing. The hearing loss can either be partial or full, either in one or in both the ears, and happen either gradually or suddenly. Thus, hearing disorders result in experiencing partial or total inability to hear speech and sounds, leading to difficulties both in comprehending and communicating. People who suffer from hearing disorders may manifest the following traits or characteristics. They are behind their peers in terms of oral communication. They ask others to repeat what is said in a slower and clearer manner. They talk louder than persons with normal hearing ability. Their speech and other sounds are muffled and inaudible. They tend to withdraw from social settings and conversations. They have difficulty understanding conversations, especially in noisy environments. Hearing sounds more clearly in one ear than the other ear. They need the television, radio, or phone speakers to be louder than others do. They have difficulty in hearing and differentiating high-pitched sounds and voices. They get exhausted from keeping track of conversations or sounds. They may find it difficult to maintain physical balance or they feel dizzy. They may suffer from severe headaches. They can also experience ringing or buzzing sound in the ear. They experience sensation of fluid pressure and pain in the eardrum. And they can have fluid buildup and discharge from ears. The following signs may indicate that infants have hearing disorders and suffer from hearing loss. The baby does not turn its head towards a noise before the age of 4 months. By the age of 12 months, the baby still has not uttered a single word. The infant does not appear to be startled by a loud noise. The infant responds to you when it can see you, but responds far less or do not respond at all when you are out of sight, even if you call out its name. And the infant seems to be aware of certain sounds. Similarly, the signs of hearing disorders and consequent hearing loss in older children are the following. The child is behind other children of the same age in oral communication. The child keeps saying what and asks to repeat what you said. The child talks in a very loud voice and tends to produce louder than normal noises. And when the child speaks, their utterances are not clear. In like manner, hearing disorders and associated hearing impairment affect people of every age suffering from it. The severity of hearing loss is categorized by how much louder volumes need to be set at before persons can detect a sound. Thus, we can speak of four levels of hearing loss or hearing impairment associated with hearing disorders. They are the following. First, mild hearing impairment. Persons with mild hearing impairment can only detect sounds between 25 and 29 decibels. They have a reduced ability to hear sounds in relation to people with normal hearing ability. They may find it hard to understand what other people are saying, especially if there is a lot of background noise. Second, moderate hearing impairment. Persons with moderate hearing loss detect sounds between 40 to 69 decibels. For these people, following a conversation would be difficult without using a hearing aid. Third, severe hearing impairment or deafness. Persons with severe hearing loss only hear sounds above 70 to 89 decibels. These persons, for all practical purposes, are deaf. They cannot understand speech through hearing even when the sound is amplified or they have a hearing aid. So they must either lip read or use sign language in order to communicate. Fourth, profound hearing impairment or profound deafness. Persons who cannot hear a sound below 90 decibels is said to suffer from profound deafness. Often people with profound deafness experience total lack of hearing. They are unable to detect any sound at all or hear anything at any decibel level, even with a hearing aid. They carry out communication using sign language, lip reading, or by reading and writing. In the next episode, we will talk about types of hearing disorders. Thank you for watching this video. Stay blessed until we see you again with another video.